Well, Jeremy, Lou Gehrig's disease is also called amyotrophic lateral sclerosis, or ALS. This is a disease of the nervous system that affects your ability to move. Your brain is connected to your muscles via two circuits, one that goes from your brain to the spinal cord, and one circuit that goes from the spinal cord to your muscles. In Lou Gehrig's disease, these circuits are degenerating for reasons that we don't fully understand. For some patients, this is a genetic disorder, but that's extraordinarily rare. For the majority of patients, it's not inherited from a family member, but develops for reasons that we don't know. Patients typically have a variety of symptoms and need to seek care if they are concerned that they have weakness that may be due to Lou Gehrig's disease.
Darrell, it really depends on the kind of soda you're drinking. The average soda drinker in the United States has 150 quarts per year, so it's a large volume. If it's caffeinated soda, then you're getting extra caffeine, and that's a bit of a stimulant. If it is high sugar sodas, regular sodas, then you're getting extra calories, which could increase your risk of gaining weight and possibly even your risk of diabetes. There are also problems with the gas in sodas. Some people are sensitive to the carbonation, and the amount of phosphorus can also be a problem, and you can get tooth decay from sodas.
Well, AJ, it's hard to tell because from your initials, I'm not sure if you're a man or a woman, but in both situations, testosterone definitely has an effect on brain chemistry. And it really would depend on the dosage. In high doses, for women, there clearly is effect where testosterone will increase interest in sexual function, will increase libido. And in fact, there have been some people that would even advocate giving a little testosterone to increase sexual function. But that has to be done under close supervision because it has its side effects. But there's some interesting data that besides sexual function and increasing libido, testosterone may also have an effect on sort of how men and women think. And it turns out that perhaps testosterone has a effect on the visual spatial relationships that men may be better at than women. So there's not much known about it right now, but we're learning a great deal about whether or not testosterone has an effect on how we learn.
Well, Helen, as you're aware, a hysterectomy is a surgical procedure that we do to remove a woman's uterus. The uterus is the organ within a woman's belly that carries a baby during pregnancy. A hysterectomy is performed for a variety of different reasons, either endometriosis, cancer, or other things. And depending upon the reason of the hysterectomy, other organs can be removed at the same time, like the cervix, fallopian tubes, and ovaries. If the ovaries are removed at the time of a hysterectomy, and you are before having menopause, then you would go into premature menopause, and you may have an increased risk of osteoporosis as well as heart disease. Hysterectomy itself is a very commonly performed procedure, and the risks are low, but they include bleeding, which may require a transfusion, blood clots, infection, wound problems, or injury to surrounding structures like bowel or bladder. The important thing is to talk to your surgeon directly about his procedure and his outcomes before having the surgery performed.
Hi, Anne. Well, really there isn't an age in which you should start using birth control, but rather it's important to start discussing sex with your child as early as possible, preferably around the time of puberty. The earlier you start the discussion with your child, the more likely it is that you can help them make the right decision about protecting themselves against sexually transmitted diseases and the risk of pregnancy.